when they are driving, I see some people shifted to one side and then their steering wheel is in the middle. So with their posture, as much as possible, you should make sure that your back is, covered.
As I mean, who say normal mammy. Wow. Me call jogging Sunday be me call jogging. See, as I mean, in Philippines, sir. But I said, my age man non stop for 1 month. I want also fillet of breno, breno.
Who say Mrs. And I'm a 9 as a hatching. But later on, I realized these are boys. Almost, they are also facing the same problem.
Oh, okay. But we mean a my house. What you say? Oh, the chia and can put the man why you see.
Why? Wow. You know, for some time now, I have been using Pragya, and then since I'm into this tricycle business. And then one thing I have noticed is that when you use the Pragya for long, you realize, you will develop some kind of health issue concerning the Pragya ride. And then I don't even know whether it is the cause of the Pragya riders or maybe it is the Pragya itself. Today we are in town to ask 1 or 2 questions with the riders to get their experience, with using the Pragya, whether it is the cause of the Pragya or it is the person using the Pragya. So we want to find out why this issue is associated with the Pragya use. Thank you.
On the move, see, till the road you already know. Every turn a brand new view. It's on the move, see. Subscribe.
Now, Udi, your first say.
Oh, your friend Tijani Ibrahim. I bet my friend Rich Khalifa.
I don't know what you're motor anyway.
Yeah, I'm not sure good motor.
Okay, now how long now? What venture and I say what's our Pragya business?
Oh, my bamono for many 6 years.
But so what you Pragya for how long?
Because 6 years.
Wow, 6 years be umpa. All right, Tijani Nana, you perceive where issue be a lot of Pragya riders no. I can't about health first saying problem omunya about Pragya na omo the omuchi. Baby they can say almost say omuchi Pragya na edum na bia be hu so omo say experience some kind of waist pain bi omo nipedua omo ye bi ni ade. Oh, as a driver now, what use Pragya for like your friend says 6 years here, okay. How expenses? Why expenses are condition be pay?
Oh, and the Jawa say na your program there. And the experience in the na your form waist pain, body pain. Hey, walk out your new driver crown now, but your Pragya ni chukrana. By 1 week later, crown crown to me be unsano. On San Moy, the dancer down San Agene. Do many days be a son. I want to say, okay, I bet normal for your body system.
Who say, I go for break, so almost a siena, almost trank of former who Pragya chia. Or Chef Pragya, see, or bet straight, no a cheap Pragyano. I feel the Omunya experience, we are say, oh, much ya. I will see an animal. Who was a driver? Why expensive is a may who send him? Oh, me cry, me so sad. I say, me 2 hours, me wa. Pragyana is one. Maybe I sit near that one short. It is also trying to now. Won't mean drive properly. By over chum, what you cock take a crown. I want to say, go to Jenny winning Abba. Space about them can what's my feel driving. So I will try and finish driving. Won't mean drive papa. And nothing about say, be an boys in a train chain. I only say a driver. It also experience our Pragyano. Anything, but you say who?
What's the young riders? It means yeah, Yana, Yatina, city good stuff. Yana, Yatina, so what you say? Going to be out now one side, see, no, okay, still a Yan Yatina, because immediately it will in 50 the correct.
Wow,
so what you say? BBNC, but no prano, where Chidom Penny was no dear, and dear, normal, so what I say. Until no, a city postano, the most is Ioya, the most is Ioya. But come who say, Piano, Omoye, Nase, a dumb. A family say, who beat me, I BBC. So what I say, what Nancy, I'll beat my BBC.
Yes.
And mum, the transit, BBC, I'm to say, a moment she pins no echo. So what you say? No much pains in echo.
As Obia who are into this Pragya business. Once who experience and answer, I dear Ben, I bet you can fast a problem here, complaints here, Pragya for Emma, it was streety. I dear, I was over can't affirm.
Sir, Pragya, not na see mouse see.
Yes.
Okay. That's it. Pragya no. I dear man who want to say, what's na say cha? Na what's that thing ya problem with your waist? And seat no so the one my end and yet soft enough. As a seat no, and more than that I will take care. Aha, and you know, as I now na say na ma. As I say, it now affect your waist. And I'm both push inside the also now. To me stretch your nine no. Extend your car. Over stretch your nine like free. As to it them yes or nine up one. They're not supposed to be affected moja inflow near.
Wow.
Wow. Not supposed to any na can on a map with them.
It also says Pragya riders for no omu go through a lot of issue but omu one person beka. Okay, the way I will teach him here.
Oh yeah. When a bus sitting in the you sure say nipa be problem. Because push next say na what mean them. What was straight see.
What was straight?
What was straight? Yes, answer I was fine no.
Say be mo so chia eba no pa.
Say chia no mo nipa be chia ba no is because otenemu sa na afi wa bre. Otenemu straight sa wa bre. Nti o shift say na be ya obetumi aye relax kakra. Nti ka Pragya no at least enka design no a bit comfortable. Maybe a betumi atwere mu kakra na ye nan no so e betumi akọ inside kakra na ya so much. Say na TVS model net here. TVS Pragya. Nke be boa.
Wow. It will be say we kire say Pragya no wo tena straight na obi a sebe o wa no I mean na no ntimi nko ho ntade say o chia na.
I just o chia no ho.
Wow.
Sana wetimi atena se afele okay.
Na nti mpaso kire the way a etie no.
On Pragya no. Oh. Ukotoje ni o. On say ukotoje epimade no. Obebre. Nti wo de what na no say ya. Our driver feel comfortable. By 15 say no obre wom. By I know say na kay good by ntimi nye. Ya trans say ya manaka ye ho.
Wow. It you say we statement waka say wo trans straight na na ye good. It also say Pragya no here omo ye no I mean issue bi wo ho ana because Pragya nke wo say wo trans straight na wuchi no. Afa de ebewi akira na wachia. It won't say problem bi wo ho ana say won say ye normal.
Jam bro for some dey o timi ka say on timi ni omo nko challenge because unim dey ya omo hwem dey omo adu.
Da bi say wo so na wo twinti no.
Say Pragya dey me so me won say problem wo ho dey. Ai. Omo no no dey buy to first system ni ko nanim ni na system na e ko nanim no. Na o sesa ne ma engine kwa wasesa engine nti ade nti na wo hu say obeye den half ni wo fam na obesesa no. Hu ni say ofa ne normal thing bi ono dey buy yenso ye bre wo ho.
Ba hu say Pragya no ye wo mu different types. We ni nko na yesa na say other brand no so wo encounter say problem.
We mu type say no so na yesa na we so na mu ye de.
We no Bajaj we nemu ye de.
We dey o twi a o feel okay. Ba no so na yesa TVS wo dey TVS dey mu wa. Na o ti wa say o to car mu ankasa mu so kama.
Eti TVS
ba you ti mu so a no so no say me dey kan ni mode ni nya me guy.
Oh okay.
Mode ni dey nya me guy. Ba ni engine sound dey me feel it. Ba say dey o ma mode ni dey me feel it. This minim say no so ni bi nso ntina ma boys ni na ye dey. Empe TVS na o pe Bajaj dey a motor be like one thing. I think so. Ekita kuma because ana yanga few many people ni na no ye ni jisaka motor we no ya man motor we agidin.
Bajaj enu nso na omu enya problem e wo ho yi o so anhu ade enu nso nti na enu nso na omu nya problem ho because Pragya wo betia na wo twika na wachia. What you say?
One say, and also second one say, your fork near Baku. One fork. One steer pin near Baku. Sanke, say to say, abobo ya de no mutie na se o se ndia wotimi tran fifi ofele bai akwai se ya ba ko nti wotran fifi na nkofo bi tie chire na wait wo ma etwon nti so far se be twon na e de ko tran echan a obi anso ahonde na obu ha na ahonde wo ne left and on the right nti so otran fifi no na se wait ni be shame e wo no so a ontimi control steer no nti wo so ba nchen se de obeya na nsa we ebetimi handle machine
wow actually you know seat no oma hwe se de oma de be
mbacho be se ehu ehwo ne bi o se ka se de na ba na chi a
we no we say ebeba na chi kaka na be ya wotena mu a
wow
so bit my ayi bi say na nka ekọ kakra
oh okay
ba we mi na my sa o so ati ase ko na chi a nka wotena mu a na wa yi ni say
wow
eno no mo o fiele comfortable kakra wow say say no we no straight dodo
na fe na matiase ene say Pragya riders bi bre na ebre omo bre pa woni twie no ho no
eno de sisi ne ni twie ne de ni twie ya
wow
ka se ni twie ya mboa Pragya de ni twie ya o she
enti aba ni say no den na mo logic complaints bi ama mo mpanifo no mo hwe mo so ne ade no
one day I don't know say logic complain kra ni se om de be kwa na so mo fanko
because me ti say un say buy no na omo any doorway un so mo complaining here for safety no me nei e hwe a bi ma ba doors na ba nti e bi a se si ayi a un betimi atwe si na ye den akọ na chi a wo kan omo aye ne ye
na chi no sa
nkate uhu ne say
oh eno de nkaya company for betimi ka tre manufacturers no na nka
mama space kakra ye den abam
mama space kakra ba ma
wow
ya mama we na ba na chi se de hotna asia betimi that is a taxi on the taxi utimu a na why
feel comfortable enti mi hu ni say Pragya for no so I say regular checkups and head and yomo omu nya time kure nkohwe omo
because no dia me nyini
dey ntia
ade no ankasa eye mema isuban sa na ade na akoye mema isuban regular checkup there yenko ankasa
wow
yenko ankasa
wow because omu show a sign bia say Pragya no mu twi no omo position omo posture na omo de ewo Pragya nanim na mo problem nti amenkofo bia nso hu so ya no pa no waye den watena se no watwi but how pa
wati dompe no ni usisi on ti gisa wa fa kwan bi so etiti ebia ebetwitwiu na ya ade na anti uya adwuma kakra na menkwatena ho oda ho wadi ase
wow
mi ya adwuma kakra ma koda wa besia ya madama
why fan was sent to us now we health issue be na and we complaining of body pains here the yankofo family bi why encounter be pain
sana me di kan no so far as I would keep Pragya na e straight that bia wo sisi no dey dey obenya dey me my encounter
any ehu
yes it got to a point and I'm the machine you can afford about the
wow
because me who say me sisi and I'm 9 as a agene but later on I realize these are boys almost they are also facing the same problem and we came to a conclusion and realized a sitting posture no
wow
because 9 time be akwa when I would go straight say when I go straight it may be a waste problem but
me there sometimes be one more me body ni na atimi me ya once I me feel waist pain
Pragya ni twi no
ko exercise o ma me ya obi a me tai ko jogging every Sunday bi ati as I me hu ni say normal ma me
wow
me ko jogging Sunday bi me ko jogging nti as I me Philippines by say my me ejuma non stop for 1 month I won so feel obre no obre wo ho
but who's the passengers for bebre no so e kasafa obi wa wote wafa no na wode wo kona wo be say watia sa na ya no musuro bi go mu say 3 times ebe tia na ebe moto no bedan wonye so say ne dan nkofo bebre no
oh there be and your experience no so onye perfect driver there and never done no
wow
bye once the passengers for need to me complain say the other near tran no bye obi on ma once what dressing neat my dress gentle me tia no na say me ntwi to fita na me na ni abonten a oni hweka by boys bi one more no ne wa twa ba nche no kwa ne na ba ko se si abonten e dey yi flexing I know na passengers for no hu ana omo suro
no
because three ties na den ti na onan mi onu kwa nche nsa na wo de onan ba ko epi abonten na wo pa che se den
wow ana passengers for nso de na omo hu se mo chia na omo suro na nso se na be ka kire
passengers de no de say one thing so ni say ono as passenger no ono so ode ne nkwa because sometimes wo chia wo as a rider no wa chia utebetumi ama load no me fa ne say bi obi a ne mood wo wa chia correct obi a ne mood nso abetena immediate right or wachi utebetumi ama machine no cry den adane wait na be go one side
wow
auntie no say wa bra na wa ko ho no rest wa stretch na be ya nya say na wo machine na wa chia wo ko one side utebetumi akọ se
now last word Ben abet with your mom here and riders for no
omo am give it back and say riders no omo hwe say dey ya omo team no ni say dey omo yi adwuma no wo ye no continuous no so e bia mi fan say adwuma na mu ye but dey wa ho me kakra adwuma ho me so adam and so lay flat that flat so what you see
wow now we do see that kind of way now more
wow no so any things no it is a effect we go kura da ati kura translate na reduce so what you see
wow what dem mo nka for about say ye ka ho asem say the be ya because obi nso say ono nso go through that problem na nkofo we what the Pragya mo obi no beba no akra bia na chi ene de me nsa mintimi nko ochena ene ade it also say Pragya no the way omo tena no ha won pa
say the esi na no be na fit no what na we twa chenkwa be 3 years e ko dia and there who be experience what na fit no what na nten wow na be experience
wow it's also say better was wow nanti o last word ben ana wetimi aka che riders na etie for muti
America ni say mi senior man bi ka chere mi say Pragya ne de how I no we ya dey house we benya problem enti na mu nche we ya adwuma kakra no wa ko ba bia atena na wa tini o wa stretch o stretch ya o so ya no fa na o be adwuma bi sa na me yes squatting kakra na my waist exercise na be bia kwa no
what stretching wow
exercise will help enye nche we ya check kakra abi we ya for rest
the last word I make a che omo hwe me say Pragya na esi wo no eye car esa ye machine bibia atimi ba ho by your driver no yen hwe your driver ni mu ye because rough drivers for ni de enye easy ti de me so omo hwe me no say omo hwe driving ni passengers for so be from motor na hwe nipa ne driving na hwe ne ye nanim asa na wa fo motor no ti me de me crop for omo hwe me no say mo so mo mayen de ehuni na Pragya no so ye na yentimi ade eni jembrem edamase
yes that's pa wow
Francisca Eyramku. I'm a pharmacist.
all right Franca I think there's an issue that has happened between the Pragya riders they do complain a lot about how when they use the Pragya often they do experience some kind of health issue
Okay.
and then we wanted to just find your opinion about some of the things that they can do I mean as a health personnel that some of them can know and then we can just resolve this issue because I think it's an issue that is worrying them.
Okay.
I mean, what can you say about it?
Okay, thank you. Their issue, I think it has to do with prolonged sitting and then posture during driving. Since they are commercial drivers, they sit for long hours, moving from place to place. And this could be because of their posture. So if you do not sit well while driving, you may have certain health challenges such as lower back pain, you may have neck pain, you may sometimes experience headaches, you may also have DVT. So DVT is deep vein thrombosis. If you sit for a long period of time, your blood sort of gets stagnant at where it is, and then it forms clots. So these people, sometimes their legs, become big, and then when this clot is dislodged, let's say the clot moves from where it is in the leg and then it moves into the brain. Some people may have stroke. sometimes when it goes into your lungs as well, you can have something we call pulmonary embolism. So all these things are health risks that come with your posture and prolonged sitting. So with this, I would advise that I'm sure their seats have something at the back that will make sure that their back is well positioned. They are in the middle when they are driving. I see some people shifted to one side and then their steering wheel is in the middle. So as much as possible, if they position themselves in the middle where their steering wheel is, it would be very ideal. Also, the way they sit, if some of them lean forward a lot, sometimes when you do that, it puts a lot of pressure on your abdomen. So you may experience some GI side effects like acid reflux and all that. So with their posture, as much as possible, they should make sure their back is well supported, their neck. I don't know if they have anything for the neck area, but their neck is also well positioned behind the steering wheel. Also, when they drive for at least 2 hours, they should take breaks in between. Take a break, 5 minutes break, get down, stretch. I'm sure 5 minutes is not going to take anything away from their cells. So 5 minutes stretch so that blood circulates very well, so that they don't experience any clots formation. They stretch out their muscles and all that. Notwithstanding, people who drive a lot or who are professional drivers or who drive as a result of profession have 2 to 3 times high risk of developing all these back pain, neck pain, and all that. So if they experience any of those issues, instead of walking to the nearest pharmacy to buy Jebedol and all these NSAIDs, which will later bring them other health complications, they should seek medical care at the nearest hospital so that we can correct some of these things. Physiotherapy and medications also help correct all these problems. Yes, so that is what I have to tell them.
Doc, thank you very much for your time today. I think
You're
with your explanation, people are going to watch and then learn a lot from this thing. You know, you did mention of something. You know, some of the Pragya rider, like you said, I don't know whether you've been watching them. Mostly they just sit,
Yeah.
come, shift to the other
To the
side.
other side.
And then don't you think that is what is actually causing this kind of
Yes,
problem for
so
them?
I believe it's all about education. Probably they don't know that whatever they are doing has some effect on their health. So as much as possible, if they sit in the middle where their steering wheel is, it should help with all these things. So yes, again, please sit in the middle so that you can be able to control your steering wheel correctly.
All right. Thank you very much for your time.
Thank
And then
you
what are you
too.
telling your audience to subscribe to this channel?
Yes, please subscribe, like, and share.
Thank you very much, Doc.
You're welcome.
We appreciate your time.
Thank
evening.
you too.
Thank you.